Hello, welcome to yet another video of Acharya Nidana Academy. In this particular video, we are going to discuss the further subtype of Abhyantara Heti. So far, we have discussed the different classification of Nidana. So each type of Nidana are having its own significance as far as the management of the diseases are concerned. So Bahya Hetus are further classified based on the nature of the what do you say that the dosha prakopa present inside the body as Sannikrishta Hetu, Viprakrishta Hetu, Vyabhichari Hetu, and Pradhanika Hetu. Further, based on the nature of the causative factor, they are further classified into three: Asatmindriyartha Sanyoga, Pratnyaparatha, and Parinama. And based on the what do you say that the dosha hetu and vyadi hetu and upaya hetu, this is basically classified based on the kriya kala as such. So that means, so in the first three stages, that is sanchaya, prakopa, and prasara, there will be dosha vitiation that is going to get observed, and wherein the sthana samshaya and vyakta and bheda, so there will be vyadi lakshanas are being manifested, wherein the dosha dusha samurchana is going to take place, and upaya hetu, wherein all these six stages are going to happen, wherein the dosha vitiation will be happening and vyadi manifestation will happen. And based on the further, depending upon the nature of the clinical manifestation in Kriya Kala, they are further classified into the Utpadaka Hetu and Vyanjaka Hetu, wherein Utpadaka Hetu, they are actually resulting in the from the Nijana Sevana till the, what do you say, that the manifestation of the disease, that is what we are going to say, that is Utpadaka Hetu, wherein the Vyanjaka Hetu are those which are responsible for the provocation of the symptoms in the body. So, wherein depending upon the pathogenesis, Utpadak, that is the dosha hetu, vyadi hetu and upaya hetu, based on the nature of the clinical manifestations, that is the Utpadaka hetu and Vyanjaka hetu. And after that, Bahya hetu and Abhyantara hetu. So that is what the so far we have discussed. So in this particular video, we are going to discuss the further subtype of Abhyantara hetu. That is what we can say, that is Adho Gati. So what do you mean by the term Adho Gati? It is comprising of two words, Adha and Gati. As such, the Gati refers to the movement. Adha means what? That is the downward movement. When you think about the Adho Gati, so we are going to discuss about this. Why we need to know about these different classifications? As far as Adho Gati is concerned, so that is the exact pathology that we can able to identify. So in case of the person who is consuming the solid substances, spices have solid substances, so wherein the dosha prakopa may happen in the stomach itself. If the person is consuming the very spicy drinks, so that means, so that will be moving, that will not be stored in stomach, that will be moving from the stomach into the duodenum. As such, the nature of the, what is a pyloric antrum, so that will be open for, so the liquids, that means a little bit open, so that the liquids which are being consumed, that will be moving straight away from the stomach to the duodenum. In that particular situation, if the person is consuming more amount of the spicy drinks, so that means that will be moving from the stomach to the duodenum immediately. So this is resulting in the inflammation to happen in the small intestine, large intestine. That's how the hyperperistaltic movement will be happening in the small intestine, which in turn results in the rapid movement of these inflammatory substances from the stomach to the large intestine, thereby the facilitation of the movement of these pathogens into the downward direction very rapidly. Instead, if a person is consuming the solid substance, that too spicy substance, so that is resulting in the closure of the pyloric antrum for a period of almost 2 hours, wherein the inflammation will not be happening in the duodenum or small intestine. Inflammation will be happening in the stomach itself. Thereby, the person may have the reverse peristaltic movement. That's how the person may be getting the Urdhva Gati of the dosha in that particular situation. So, this is the idea why the dosha or the pathogen that will be moving in the upward direction and downward direction. To know the prognosis of the disease process. What do you mean by prognosis of the disease process? Prognosis in the sense we are going to predict what may happen in the body, whether the pathogens are be present only in the alimentary canal or whether the pathogens are moving from the alimentary canal to the intravascular compartment or whether the pathogens are moving from the intravascular compartment into the interstitial compartment or the pathogen that may move from the interstitial compartment to intracellular compartment. If the pathogens are being present in the alimentary canal and the intravascular compartment, in that particular situation, the prognosis may be a little bit good. Suppose if the pathogens are present even in the interstitial compartment, in that particular situation, the prognosis of the disease may be a little bit moderate as far as the severity is concerned. If the pathogens are being present even in the intracellular compartment, that means intravascular to interstitial and intracellular, in all these three compartments, in that particular situation, the prognosis of the disease process will be comparatively poorer. And to plan the line of treatment, Ayurveda says Asanna Margaharana is the line of treatment for any of the disease process. Asanna Margaharana means what? The dosha Utpatti, usually as per Ayurveda fundamentals, that is going to take place in the alimentary canal. So that's why Amasha Samutta and Pakwasha Samutta are the two types of the disease are being mentioned. If the person is suffering from either Kaphaja or Pittaja Vikara, then that has to be eliminated, that has to be pathogens has to be brought into the Amashaya. And if the person is suffering from Vata dominant disorders, the pathogens has to be brought into the Pakwasha. Suppose if the pathogens are being present in the intracellular compartment, that means the kapha dominant kapha producing pathogens are being present in that particular situation, that has to be brought into the interstitial compartment. From there, it has to be brought into the intracellular compartment. From then, the pathogens has to be brought into the amashaya and then vamana has to be carried out. If the pathogens which are responsible for the pitta domination in the body, in that particular situation, the pathogens are present in the intracellular compartment, has to be brought into the interstitial compartment. From there into the intravascular compartment. From there into the alimentary canal, that has to be eliminated in the form of purgation or virechana therapy. If the person is suffering from vata dominant disease and pathogens are present in the intracellular compartment, that has to be brought into the interstitial compartment. From there, intravascular compartment. From there, it has to be brought into the alimentary canal and that has to be eliminated through medicated enema or basti. So this is how the planning the line of treatment can be done depending upon the nidana in the body. To predict the progress of the treatment, progress in the sense, suppose if the person is suffering from the disease and based on the clinical symptoms, if he is deciding he is having the 100% of the disease as such, by giving the line of treatment, in the first week, if a person is taking the treatment, he may show 15 or 20% of improvement. That means 15 to 20% of the symptoms that are going to get reduced in the body. If the person is further continuing the treatment, another 40 or 50% of the diseases are going to get subsided. On this third subsequent visit, the person will show 70 or 80% of improvement. So, to predicting the progress of the treatment also, the knowledge of Nidana are essential. As far as the types of the Abhyantara Hetu are concerned, three types are being mentioned: Urdhva, Adha, and Tiryak Gati. And Vriddhi, so that is increased Lakshana. Sthana, that means normalized function. And Kshaya, that means decreased function of the Abhyantara Hetu there. Shakha, so that is we are going to discuss in the further sessions as such regarding these further subtypes. Shakha, Kushta, Marmasti Sandhi, Chaya, Prakopa, and Prashama, Sama, Nirama, Prakriti and Vikriti, and Ashaya Pakarsha. So these are the further subtypes of Abhyantara Hetu. As far as Adho Gati is concerned, as we have mentioned in the beginning, the dosha that is moving in the downward direction, or the pathogens which are responsible for the disease manifestation, they are moving in the downward direction. So that in most of the occasions, these pathogens are entering via oral cavity. So in that particular situation, the other two factors that are going to get very important as far as the Nidana assessment, that is the number of pathogens and virulence of pathogens. Suppose if the more number of pathogens are entering, and if the person is consuming more amount of the liquid, in that particular situation, these pathogens, they are moving along with the liquids from the stomach to the small intestine. That's how the downward movement of these pathogens are going to get happen. Thereby, inflammation will be happening in the alimentary canal, particularly small intestine, large intestine. Thereby, elimination of the these pathogens are going to happen in the downward direction. And virulence of the pathogens. That means more virulent pathogen. So that will be responsible for the severe inflammatory process happening in the alimentary canal. Thereby, the downward movement of these pathogens that is going to get happen in a rapid fashion. Suppose if the virulence of the pathogens are milder, then downward direction will be slower in progress. The one of the main question, as we are going to say, arised in the Urdhva Gati. Adho Gati means what? Whether is it happening only in the alimentary canal, or whether will it be happening in the intravascular compartment or interstitial compartment or intracellular compartment. So based on the what do you say, that the principles of fundamentals of Ayurveda, so that means the pathogens which are moving in the only in the alimentary canal. That means if they are moving in the downward direction, that has to be considered as Adho Gati. If the pathogens are moving in the only in the upward direction in the alimentary canal, that has to be considered as Urdhva Gati. If the pathogens are moving from the small intestine, large intestine into the intravascular compartment, from there into the interstitial compartment, from there into the intracellular compartment, they are being considered as Tiryak Gati. We are going to discuss in the further sessions as such. That means Adho Gati refers to the movement of the dosha that is going to happen only in the alimentary canal, not in the intravascular compartment or interstitial compartment or intracellular compartment. So why we need to know about it? So that means, suppose if you are knowing the pathogens are present in the alimentary canal, the line of treatment in such occasion is very easy. So that means if the pathogens are being present in the stomach, that has to be eliminated by a Vamana or emesis. Or if the pathogens are being present in the small intestine, that has to get eliminated via purgation or urechana therapy. Or if the pathogens are being present in the large intestine, Two types of treatments are possible. We can give virechana, as we have mentioned, purgation, or we can give basti. So that means administration of the medicines via anal route, thereby that will be eliminated via anal route. So that means the administration of the medicine will be via anus, and elimination of pathogens will be happening via anus in case of the pathogens, presence of pathogens in the large intestine. So that means if the pathogens are present in the small intestine, large intestine, that will be eliminated via virechana or basti. So the take-home messages from today's discussion are: the term Adho Gati refers to the downward movement of the dosha or pathogens in the alimentary canal. So that means if the pathogens are being observed in the lower limb, that will not be considered as Adho Gati, that will be considered as Tiryak Gati. If the pathogens are happening, that is what we are going to say, the skin or groin, if the pathogens are being present, they are not considered as Adho Gati. And when the pathogens are moving in the downward direction, then we have to facilitate the movement of the pathogens in those occasions. For example, in case of the Atisara. But this, there is an exception for all these. So that is what we can say. That is the reverse movement. That means the person has to be given the vamana if the downward movement of these bleeding are going to happen. So that means which are responsible for the blood circulation to happen in the upper alimentary canal increased. So thereby there may be a chance of a decreased blood circulation towards the downward direction. That is the main idea behind the, what do you say, that's the Adho Gati as such. Dear ANA members, what are the major key takeaways from today's discussion? Mention in the comment box. What is that particular one video would you like to hear in this particular channel? Mention in the comment box. If you are liking this particular video, then put a thumbs up and spread this particular video with the maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. In the next video, we are going to discuss about the Tiryak Gati of the pathogens or the dosha. Thank you.